Good afternoon. Today I wanted to talk about a couple breathing exercises that you can utilize at home when you're doing your breathing treatments that can help possibly improve the quality of which your oxygen transfers through your lungs. So first one exercise we're going to talk about is when we're sitting. And what I want you to do first is just going to sit down nice and easy, keep your posture straight and tall. From this position, you're going to take your fingers, you're going to put them at the tips of your kneecaps as a reference point. From here, what I want you to think about doing is pushing your right knee into your fingertips and pushing your left knee away. So it's going to shift your body. So I'm pulling away from my left side and pushing into my right. And that's going to change my position here. From that position, I'm going to take my hand at my rib cage and I'm just going to tuck it down. From there, I want you to work on your breathing, which is in through the nose as much as you can. And exhale through your mouth as much as you can. Trying to maintain this posture. As you're doing this, you may feel your left side, the inner thigh, or you may feel the outside of your left. Then you're going to reset yourself after about 3 to 5 breaths, depending on how you can do it, and try and do this again. My recommendations is every 10 minutes, sit down and go into this posture. Now the second exercise is, if you want to change it up a little bit, is we're going to go standing. So what you're going to do is put your left leg forward and your right leg back, keeping your hips in front. What you're going to do is take your fingertips, you're going to push your hips back so you can feel that left hamstring. Then take your left hand and put it at your left rib cage. You're going to breathe in through the nose like we talked about, as much air in. And then when you exhale, you're going to tuck your rib cage down and back just on the left side. So once again, we should feel this on the left side. So it's breathe in. One more. So as you're doing this, we're taking this rib cage down and back on exhalation. And what this does is it helps bring our rib cage down, but it helps us improve the efficiency as we transfer oxygen. Now, when you're doing this during your breathing treatments, it's going to help utilize that time when you're doing this. So our recommendations with this is every 10 minutes, just 3 to 5 breaths, whatever you can, get in one of those positions, whether it's sitting down in the chair or standing, and then working on breathing in as much air through your nose. And when you breathe in through your nose, you want your whole lower half from the rib cage to the pelvis to expand. Think of like an inner tube. And then you want to exhale through your mouth as much as you can, as if you're like breathing through a straw. So it's, and what that does is brings all your muscles on that rib cage and pelvis closer together. So try these 2 exercises out during your breathing treatments and see how it goes.